Chào mừng quý vị khán giả đã quay trở lại với số thứ 6 của chuỗi chương trình tư vấn di truyền thảo luận cùng chuyên gia của Trung tâm Tư vấn Di truyền GENTIS. Đây là chuỗi trao đổi kiến thức y học của Trung tâm Tư vấn Di truyền GENTIS với mong muốn cung cấp các thông tin đa dạng và hữu ích tới toàn bộ các bác sĩ, chuyên gia, sinh viên ngành y và khách hàng quan tâm đến lĩnh vực này. Và tôi, thạc sĩ bác sĩ nội trú Đinh Thị Quỳnh Ngọc đang làm việc tại Trung tâm Tư vấn Di truyền GENTIS sẽ cùng làm việc với các bạn ngày hôm nay. Trong talk show ngày hôm nay, chúng ta sẽ cùng nhau trao đổi về chủ đề vai trò và sự kết nối giữa bác sĩ Lâm Sàng, bác sĩ di truyền và phòng xét nghiệm di truyền trong chẩn đoán và sàng lọc bệnh lý. Mục tiêu của chương trình này là thảo luận về vai trò của xét nghiệm di truyền trong việc sàng lọc và chẩn đoán các bệnh, đặc biệt là sản khoa, và làm rõ cách mà các chuyên gia có thể hợp tác để nâng cao chất lượng chăm sóc bệnh nhân. Và chúng ta sẽ có một sự đồng hành vô cùng đặc biệt ngày hôm nay mang đến những cái thông tin hữu ích về chủ đề này. We would like to introduce for our audience 3 experts who will accompany the 6 episodes of Genetics Consulting Discussion with Experts program today. The first, Miss Katie Battese Ellis, Senior Director, Medical Affairs, Illumina, in charge of several countries in APAC regions. So, Katie, could you have a greeting for our audience?
Hello, everybody.
Yes.
Thank you for having me today.
And Katie has more than 30 years clinical experience working as a genetic counselor in all disciplines of field in the public, private, and commercial setting. Katie has a Jungies certified genetic counselor under the Human Genetics Society of Australasia. She founded the clinical genetics unit for the ACT and Surround in 1997 and was the sole practitioners of region, where she also facilitates several patient support groups and participates in the government advisory groups. Katie wrote the genetic components for several medical programs in Australia, as well as chairs of genetic counseling, ethics, and patient education group of the International Society for Prenatal Diagnosis. And she is a senior manager medical affairs for Illumina, covering several countries in the APAC region. And next, let me introduce the second expert member to today's talk show, Associate Professor Dr. Hùng, Deputy Director of the National Center for Reproductive Support. And welcome, Professor, for coming here today. So, could you send
So thank you very much, and I'm very happy today to be here to meet with a very famous person and expert in the genetics,
Yes.
in the genetics. So thank you very much.
Yes, thank you, professors. And the last expert member of today's sessions, I would like to introduce Dr. Phạm, Minh, Director of GENTIS Genetic Consulting Center.
Yeah, good morning, everyone. Yeah, thank you for coming here, and I hope we will have a fruitful and also interesting, helpful discussion about genetic testing and the update about how to use the genetic testing in Vietnam, and also especially in the field of therapeutic medicine, OBG, and other fields of interest.
So thank you, all of you. Thank you. You took your valuable time to come here and participate in our program today, and I hope that we will share very useful knowledge with those who are watching the program, and especially for the doctors who are directly practicing in the field of reproductive support and obstetrics. Through the initial sharing of the experts, I believe that you have seen the practical meaning of today's talk show, right? So please quickly interact and share this online talk show link so that many other people can access this important information. If you have any question and any comment, please quickly comment on and so that we can answer this on this live stream. So in the past 5 episodes, GENTIS Genetic Consulting Center has received a lot of positive feedback from everyone. In particular, we received a letter from a viewer who want to learn more about the genetics and geneticists in disease, in diagnosis and screening testing. Realizing that is a good topic and interest for many people, we decided to organize a talk show. The role and the connection between the clinical physician, geneticists, and genetic labs in diagnosis and screening. And the first question is for Miss Katie. And so Katie, could you provide an overview of the roles of geneticists in diagnosis and screening testing?
Of course, thank you. So in the past, geneticists, we didn't have many tests available, and we relied really on examining a person and putting together the features. Perhaps they had a change in their heart or difficulty with their development, and we tried to put this together like a puzzle to work out what had happened with that person. These days there are many tests available, which has made things actually much easier. So if a person has a particular disease, then we're able to do a test to try to understand how did that disease happen, and what perhaps there might be a better medication for that person or a better treatment to help them in their life to be their full potential. This could even be in cancer, for instance. But also we now have screening tests, which is very different. This is for everybody in the population, and this is because we all carry changes within our bodies that we can't see, changes in our DNA, our makeup. And these changes don't affect us, we are very well and healthy, but when we have children, they could affect the child. And so now these screening tests could be done before a pregnancy to see if you and the partner carry the same condition, or you can even do a screening test during a pregnancy to see how that baby is developing. Often that, for looking at chromosomes, they are not inherited changes, they just happened in the baby for the first time. So there are now so many options available that really help us understand human disease better, and then hopefully better treatments for the future.
Yes, and we understand that the genetic testing has an important role in our diagnosis and screening. So which genetic disorders require early screening? How do we decide whether to conduct genetic testing or not?
Those are very big questions. So in trying to decide when somebody should have a genetic test and which ones should be early, particularly there are conditions that can affect children early on, and they might have treatments available. So throughout the world and here in Vietnam, there are some conditions that we test on newborn screening when the baby is just a few days old. The reason for that is that those conditions, we can have good treatment for the baby very quickly, and it is very important that we give the baby that treatment so that they will be as well as possible. So that becomes very helpful. But understanding actually most diseases early on is beneficial. Even for cancer, if we can diagnose and understand the cancer much earlier, then our treatment has a much higher chance of ensuring that the person has the full recovery. For your next question, I think was about the...
Yes, how we decided when we are doing the screening testing, because you know that for some reason or in some case we decided to not doing the genetic testing, and why not?
So with this question, sometimes people don't want to have a genetic test performed. Maybe they are frightened of what the answer will be, or maybe they are worried for their family. So it is an individual choice as to what will be the best for that person. I think it is always best to have a conversation, discussion with your doctor or your genetic counselor, but also your family, because sometimes we fear what we don't know. But when we have a test performed, it was not so scary because it gave us information that we could then do something about. maybe it helped us on our journey to become a parent, because it helped the doctors understand why we are having trouble to have a pregnancy. So I think it is best to think about all of the harms and benefits to decide if this is right for you with your doctors and your family as well.
Yeah, so if we're doing the genetic testing for screening, we can have a better preparing for the welcome the baby, right? Yeah.
Exactly, and the importance of that is because we just can't tell which of us carry the same condition as our partner, for instance. There is no way looking at us to know that there is anything that could cause a problem with our baby that we have. So that's why we do talk about doing screening before the pregnancy.
Yes, thank you for your useful information about the role of genetic testing in diagnosing and screening disease. However, in reality, the combination of geneticists and clinicians is still needed. And Dr. Hùng, could you share with us the case that requires genetic testing? And can you share some specific case that you need in a practical?
Yes. You think in we do in the IVF field, and the successful rate of pregnancy rate is around 50%, and still have some patients they do a lot of time, sometimes they cannot get a pregnancy. So as Katie Battese says, I think it's very important to collaborate with the genetic experts. So we have many cases that we need genetic testing before the treatment IVF for the patient. First of all, I think we think that it's very important for the people with the monogenetic disease. In Vietnam, we have the thalassemia and hemophilia, and it's very important to screening before the embryo transfer. So you know, in Vietnam, in the rural countries, the rate of the thalassemia is very high compared with compared to the world. The first one, and the second one is we meet many our patients with repeated failure implantation. So we transfer many times, but the woman cannot get the pregnancy. So in that case, we need to do the PGT for the patient for embryo, and we select the normal embryo to transfer for the patient. And the third case, we have some patient with repeated abortion. So the woman suffer from when we transfer for the woman, but when the pregnancy reach the 7, 8, even the 12 weeks, and the abortion, the pregnancy arrest at the time, and it's very hard for the patient. So if we select the normal genetic embryo transfer, maybe the person pass this issue. And thank you very much for giving me the normal genetic disease before such the information, the good information of embryo when we select to help the patient. And the third case is some patient with for example, she is older, over 35 or over 40. So if we transfer, we have, for example, we have 5 embryos, that means we transfer 5 times. But in 5 embryos, that we don't know which is normal, which is abnormal embryo. So thanks to the genetics, so we can choose which is a normal embryo in 5 embryos, so we will reduce the time from the treatment to the pregnancy that helps for the patient. And in fact, we have some patient like this, first time she is Down syndrome, and the second time transfer she is have a baby with Turner syndrome, 45 years old, and this patient she need to do the PGT-A before embryo because the 2 times she have to terminate the pregnancy at the 12 weeks and at the 13 weeks. So it's very hard for them and for the couple. So she needs a screening before embryo transfer. So that's why that on the example I give. So we need to collaborate with between the clinician and the genetic experts.
Yeah, thank you so much. And Dr. Hùng have just listed some reasons that we should doing the screening testing before we doing the implantation, like the parent with genetic disorders, or the implantation have failed many times, or the older, like the woman older than 35.
Yeah, over 35
years old. And he shared with us some case like the woman with the Down and Turner syndrome, right? Yeah. Should doing the screening testing before we doing the implantation. So thank you professors. And Dr. Minh, do you have any comment on this film?
Yeah, actually for we have more than 12 years of offering genetic testing in Vietnam, and actually we are one of the very first private company offering this kind of test in Vietnam market. So yeah, actually we have some experience would like to discuss and share with you. That's the first one that Professor Hùng just mentioned about for in IVF sector. Okay, IVF sector we so to now we can screen for like 100 monogenic diseases to do the PTM, and we have done like more than 3,000 circles. Yeah, PTM circle. Yeah, and we have a lot of couples who has a monogenic diseases, and now we offer the free PTM testing for some diseases and some couple which have economics problem, or they are not good in good economic situation. So we have a free program to support the poor and support the with collaboration with the hospital and with the doctor like Professor Hùng. For monogenic disease in Vietnam, from our data, testing data, we see that there are about 50 most common disease we found. Okay, and then we in our pipeline we can do 400 diseases. Yeah, and for the PTSI, and those are so common in Vietnam, as Professor does mention that. Many doctors, many patients with the disease, with the problem with the transplantation and with the pregnancy loss, something like that, and they need the help, they need the doctor to choose the good embryo, and we offer a lot of that tests in Vietnam already. And the third one with the also in other type, for example, in obesity. Yeah. So the pregnancy women they also need other kind of screening. So to help them to screen for the fetus, for the baby. So we also have done a lot of tests, that kind of test. And also in Vietnam now there are more and more companies they also offering this kind of test in the market in order to support for the not just for early screening, but also for the treatment, like you mentioned about breast cancer. So this field of testing, genetic testing and genome testing, is really booming in Vietnam, and also we need the collaboration between the physician between the geneticists and also with the laboratory in order to make the test more available, it's more helpful, and also can reach to help more patients with more diseases.
So all of you would like to have to get the good research from the genetics laboratory, right? So thank you, doctors, and I believe that the information will be very helpful for the audience who are watching the program. And before we come to the main part of the discussion, I would like to say that today's program is being broadcast live on the GENTIS fan page channel, and please quickly interact and share this online talk show link so that more audience can access the important information. If you have any question and concern about the concern that need to be answered, please quickly comment so that our experts can answer them in this live stream. So back to the program, can Dr. Minh, can you share the latest advance in genetic testing? Because we understand that the laboratory trying to providing more and more testing to the clinicians and the patient.
I think the question a little big, so I would like to share about the latest advancement in genetic testing in Vietnam, particularly in the field of what we will focus today is the reproductive medicine and also the OBG and also newborn screening. Okay, so for others, I think Katie will be the experts in this one. So you know that the Vietnam is one of the fastest economies in Asia. So not just in economy, but also the application of the new technology, application of new testing, particularly in genetic testing, in genomic testing in healthcare is really one of the big booming in Vietnam recently. Okay, so for genetic testing in Vietnam, actually. Vietnamese company and also Vietnam hospital, and even with small private sectors hospital. Now we are also investing heavily on the new tech, high tech, especially like the genetic test and genomic test for the healthcare. Okay, so now you can see the genetic testing in many areas of healthcare sector, from reproductive medicine, OBG, to cancer, to newborn screening, and many other fields. Okay, so basically we in Vietnam we adopt I think most advanced genomic and also genetic testing. For particular in the field of reproductive medicine, GENTIS already applied the NGS, okay, in embryo screening for PT test, like more than 10 years back, so very early. And now, if you compare the number of tests in the genetic test, in particular for embryo screening, so GENTIS have the highest number and most, comparing even to Asia and some country in Europe, because we visited some country in Europe and some country in Asia. We found that Vietnam really have using most advanced techniques in the field of genetic testing for reproductive medicine, OBG, and also newborn screening. Okay, so there are more and more advancement in the genetic testing because of the advances in the technologies, evolution in the technology. So we adopt more tests. We will bring more new tests to Vietnam market, and in the near future now, for example, we will apply the AI, the bioinformatics, to make the test more accurate, more can screen more disease, and also can bring more clinical information to the patient, to the doctor, so the doctor can have more tools, so to select, to not just screen for the disease, but also help them to provide the best treatments.
So, as I understand, in Vietnam and especially in GENTIS, we providing the modernist and state-of-art technologies in diagnosing and screening testing. So, when we're doing that, what are the common challenges in the collaboration and how can we address it?
Yeah, right. So over more than 10 years of, performing the genetic test in the lab. So we challenge, we faces many challenges, many problem, many question, many staff question also from the doctor, from the customer, with the testing. So I think they in Vietnam, in particular, and I think most of the others part of the world should be the same. That the first thing, the regulation. We have to strictly follow the MOH regulation on how to set up the lab, how to operate a test. Okay, that the regulation. For example, in Vietnam, we need to follow the ISO 151. Okay, for example, and some lab, they also in order to collaborate with foreign partner, a customer, we need to have the high standard lab for CIP accreditation. So that GENTIS is trying to apply now. And that's the first thing. The second thing is about, because this is also very new and also very difficult technique to perform in the lab. So we need very good technician, trained and skilled personnel to make sure the test in good quality. Okay, and not the lab equipment, but also the human resources also need very good training. Okay, that is second thing, challenge. And the third one, we just mentioned about that, how to make the test more accessible for the doctor and for the patient. Okay, so in Vietnam, with the help of MOH and also the hospital with doctor, especially some expert, we trying to make, for example, the talk show, genetic counseling events like this. Okay, we can share with the customer and the patient that we are willing to bring the experts from the clinical physician, clinical doctors, together with geneticists, expert in genetics, and also with the lab, because we do the genetics lab. So we need all the key person in order to solve the problem together. So the problem can be solved easily in high quality and bring more benefits for the customer, for the patient. Okay, so I hope that with the two experts today, okay, we show to the patient, to the customer that this is the new. We need to collaborate with many different people in order to make the test more accessible, to overcome the challenges.
Yes, and after the sharing from Dr. Me, we understand that the laboratory play an important role in collaboration between the laboratories, the clinicians, and the geneticists. We are going to the next question for Dr. Hùng. And in your clinical practice, you might have encountered many cases like this case that you discussed before. And which case impressed you the most?
Yes, in practice, I meet many couple with. So I will do the PGT before embryo transfers for them. Yes. But one of them I remember is the one couple. The wife is 35 years old and the husband is 37, and the history of this couples, they have 2 missed abortion before 7 weeks, and they also have 2 pregnancy termination because of the idiom fetus, the fetal idiom. And when we do the test for them, and the wife and the husband also carry the monogenic genetic disease of the thalassemia. So we, of course, this is a very famous example for the thalassemia person. So we need to do the PGT before embryo transfer. So we need to do the IVF and PGT. And this person, when we do IVF, when we create the 7 blastocysts, and we do the PGT, and see only in 7 embryos, the couple have only 1 normal. Yes. So we transfer, and the couple have pregnancy. They have 1 baby, the healthy baby. After 10 years of trying to have pregnancy. So it's a very, so remember the couple for that. So we have many cases like that.
Wonderful.
A long journey to get
Yeah,
a
long
baby.
time, 10 years.
10 years.
So
And
thank you very much. So that means, so we need a very important collaboration between the OBGYN or IVF with the genetic.
Yes, and thank you for helping the couple, that couple, and many other couple to get a baby. Thank you so much.
The couple, they benefit from the
Yes.
collaboration between us.
And your roles too.
So thank you very much for the GENTIS. They provide the testing set a very advanced technique for the screening for that disease.
So how about Katie? Could you sharing about the case that is closely related to the coordination between the clinicians and geneticists?
So in a similar way, there are so many cases, particularly before we had good testing, where with my patients, very sadly, many had children or babies that died from the genetic disease, and we couldn't give them much hope. We could just say, maybe try again, because we did not have the tests available. Until doctors like you came, and we had assisted reproductive technology and the OBGYN. And now there is so much hope, because I can say this was very sad for you, but now that we know you carry this monogenic condition, you can go, we help them and we explain to them. They go to the OBGYN, and then we can help also with explaining to the laboratory, saying, please, can you do a test for the embryos for this couple? So there are many couples, but I guess one particularly, this couple, they were very young, very healthy, very fit. They did all of the right things, but their first child was born with a condition called spinal muscular atrophy. It's quite common in all of the world. They did not know that both the mother and the father were carriers. And the baby died when about 8 months of age. They were so sad. They said, why did no one tell us that we were carriers? Why did no one tell us to have the test before we had this baby? We could not change that, but for the future, we did send them to our OBGYN, to the assisted reproductive technology. The laboratory was able to design the test, and they did the PGT-M, and then they now have a very happy and healthy baby. So many couples now are so thankful, when before they just had many children maybe, or many pregnancy losses. We had nothing we could offer, no hope. But now when we work closely with the laboratories and closely with the OBGYN, it's very satisfying to me to see so much happiness and hope for these couples. They can raise the family they always dreamed of.
Yes, thank you. And with all advances in technologies and collaboration between us, I hope that many healthy babies can come with us in the futures. And Dr. Minh, could you share about your experience or which case is the most impressive to you?
Yeah, actually, for us, we receive the sample from the hospital. Mostly from the hospital and IVF centers sending the sample to us. So I did not have a chance to meet the real patient. Yeah, but for us actually we have many cases that are from the doctor. They share with us. Yeah, they share with us. Sorry.
No. Keep continuing.
Okay, so share with about particular about the monogenetic diseases. As Professor Ellis just mentioned about the parent has the carriers, but they don't know that they already have a carrier. Yeah, and after having the first baby, okay, the first baby got disease, okay, expressed the disease, and then some patients they don't have enough money to do the test, because genetics test quite some time ago is quite very expensive, and also for IVF also were expensive. Okay, so we support for the patient, especially the monogenetic disease patient, to have to do the embryo. Prepare the IVF and screening for embryos, and also to select the embryo without the mutated genes, okay, without the disease. So many couples have the healthy baby after the PTM testing. So we really happy that we help the patient, we help with the doctor, and now as I mentioned, we have a free PTM program, yeah, to support for the monogenetic disease patient, and we happy to support more, and we also happy to willing to bring more newer technology to reduce the cost of the test, to make the test more accurate, and also to make the test faster, so the patient can shorten their treatment time. And that's what we already got, and we proud that we contribute to the development of this the healthcare system, the healthcare sector, particularly for the IVF sector and also OBG in Vietnam. So we hope that with the help of the expert, so we can help more patients and more doctors in Vietnam.
Yes.
Yeah.
And after discussions, we understand that we can get variety situation to have to need to get the screening testing, genetic testing before we doing the implantation and doing have a baby. To conclude this discussion, I would like to ask our guest, Ms. Katie, how can we improve the collaboration between the clinical doctor and genetic laboratory to enhance the patient care?
That is a great question. I think all of us are always striving for our patients to get better and better care. I think one thing that was mentioned earlier that I think is very important is about the education, like programs like this. So the education not only of the patients, but of other doctors, because this is quite new, even 10 years, it's still quite new. So many doctors still are learning about different genetic tests, about what is available for their patient, and understanding like the accuracy, but also it's technically quite difficult. So sometimes it can take the laboratory some time to get the result because they have to work so hard in really putting the puzzle together to understand what the result is. So I think we all need to work together to educate, as you said, like the governments and Ministry of Health, the patients and other doctors, so that we can all understand together about the tests. And I think it really helps the patients when they understand that sometimes there are limitations to our tests right now and to what we can do in vitro fertilization, but we are always getting better and we're always striving for the best. And now it might be sometimes quite expensive, but again, we work together to see how can we help save the money for the patients so that they can get the same access to this care. So for me, I think the biggest one is education. If we all have better understanding, then I think the patient journey is much better.
Yes, thank you. And also from the doctor perspective, Dr. Hùng, what should we do to enhancing this cooperation?
So I think the genetic issue is very difficult for general and even for the OBGYN also. So many things as a dietitian, we need to learn more and more day by day. So because the technique is developed and changed day by day, before. So I think, let me share my thinking. So when I graduate my university and I started to work in the National Hospital for OBGYN, and at that time we meet the woman with the idiom fetus. So maybe she delivery or she had to terminate the pregnancy, and at that time I think we don't know why she have that problem, and we only think that maybe the baby inherited something from the mother or father, and gradually and we know the baby maybe suffer from the thalassemia, for example, that or the mother or father carry in the gene, and at that time we don't know how to treat them, and only give the woman and the husband the caution that maybe they have the frequency, the rate of frequency of the next baby, for example, 25 or 50% of normal, and they have no choice. And until now, it's very amazing when we have treated some the genetic disease. Before we think it's a very, I think it's impossible.
Yes.
But now it's possible. So what is we need is we have to learn more and more. And how we learn? We learn from the collaboration like this. We learn from the meeting. We learn from the conference.
Yeah.
So we have a chance to share with the particularly the cases. And even though you share the technique, you share very particularly, and we know that. And before we think some patients we cannot treat it for them, and now some patients that you can help them, so we can share each other to help our patient.
Yeah.
Just like that.
So Dr. Hùng and Miss Katie do agree with us that we have to education more and learning more about this the advancing in technologies about genetic testing. So Dr. Minh, what do you think about this collaboration as R&D directors of genetic testing center?
Yeah, I just share for you some challenges in how to apply the genetic test in Vietnam recently. So in order to bring the new test, actually to new test to the market it takes time. It takes some time. Yeah, as Katie and Professor does mention about the important role of education,
Yes.
in the role of collaboration. Yeah, but from the perspective of the laboratory, okay, it also difficult to perform, actually, to run a test with a high quality in any laboratory. Yeah, so we think that we need also, yeah, help from not just from expert in course in the physician, also the geneticists, but also with the help of the, for example, the technology inventor, for example, Illumina, and some other company who invented the technology. So we really need to understand the technology. Yeah, need to run the test, properly in the lab to get the best quality. So the quality of the test is the critical key, right? Because if we have the wrong test result, then everything will be going wrong.
Yes.
Afterward. So the lab quality, the quality of the lab, the quality of the test is a very important key for us, okay, to improve. Yeah, so we try to get help from, to the learning from collaboration with the technology inventor, and also from our partner, from expert. Yeah.
So thank you all of you, and thank you our guests for sharing such valuable insights. Today we have explored the importance of genetic testing in diagnosis and screening, and the necessity of strengthening collaboration between clinical doctors, geneticists, and genetic laboratories. We hope this talk show has provided useful knowledge and will contribute to improving patient care. Thank you for our audience for joining us today, and we're looking forward to seeing you in the future program. And once again, thank you, Miss Katie, Dr. Hùng, and Dr. Minh to join with us today. And this is the talk show series discussion with experts at genetic counseling, hosted by GENTIS. And if all of you have any comment and any question, please continue to send a question and or inbox in the fan page GENTIS, or email in the address on the screen. And bye, and see you again in the next episode. And please say bye with audience.
Bye bye.
Thank you so much.
Thank you.
Yeah.